Today I'm going to show you how to use the AmbIT infusion pump to administer IV antibiotics as part of the CHID study at the Royal Adelaide Hospital. This easy-to-use portable pump continuously delivers IV medication to patients effectively and reliably. Today in this short training video I'm going to show you how to change your patient's IV bag using the AmbIT pump. Let's start by having a look at the setup you'll see when you visit a patient at home. The IV bag is connected by the short line to the AmbIT cassette at the top of the pump. The long line is connected from the cassette to the injection site cannula. There are clamps on both lines, but there is no need to use these. This blue disc is a hydrophobic air exclusion filter. This clear cover is the button guard. At the front of the AmbIT pump you'll see the display screen, play-pause button, round function button and the on-off twist base. There is no need to prime the IV lines as each IV system comes pre-primed. You also don't need to reset this pump because the AmbIT program has been set up prior to your patient's discharge from hospital. Now I'm going to prepare to change the IV infusion. Remove the IV bag from the protective light cover and the inner bag and place it on a clean surface. There is no need to bring the infusion to room temperature and can be removed from the fridge just before the infusion is changed. Verify the medication label against the medication order on the patient's notes. Remember, the infusion comes pre-primed, so there is no need to let it run prior to connection. Now let's remove the cassette from the pump. To do this, first remove the button guard and put the pump into pause mode. The button guard has a firm fit, so here's a tip for getting it off. Place the pump on a flat surface, grip the guard, hold the pump at an angle, gently pull the bottom of the guard upwards. Then press the Run Pause button. The pause symbol will flash on the screen and the pump will beep twice every 4 minutes whilst it's in pause mode. Now let's remove the infusion cassette. To remove the cassette, squeeze the tabs on either side. It should release easily. Let's review the pump history. First, hold down the round function key for 2 seconds. It will beep once and then HX will appear on the screen. You will then see the volume infused followed by the infusion time to date. You want to check your infusion program next. To do this, give the round function key a quick press. On your screen you will see displayed RX, followed by the flow rate and total volume to be infused. Now let's connect the new infusion cassette. With the tubes to your left, align the new cassette tabs with the pump slots and push down. The cassette should click into place. Now you're ready to change the infusion lines at the injection site. Using aseptic technique, disconnect the infusion lines from the patient's injection site. Perform your PICC care management as per protocol. Using a connector, attach the line to the patient's injection site or bung. To get the infusion started, press the Run Pause button. You will then see a review of the program. Once this is finished, press the Run Pause button again, then the program will start. Once the infusion is running, a green light flashes continuously in the function button. To prevent the pump buttons being accidentally pressed, you will need to replace the button guard. To do so, place the pump on the table, lift it at a slight angle, hook the button guard around the top of the cassette and push down gently to click into place. You may have also noticed these attached to your patients and their IV bags. These round metal discs are temperature probes that are collecting important information for the CHID study. Please leave these probes attached to the patient and their IV bags and put all used IV bags into the medical waste bag we've provided. The patient will take this to their next infusion clinic appointment at the Royal Adelaide Hospital. We've also emailed you a survey. We're interested to know more about your experiences with home infuser devices. Please complete this short questionnaire. Thanks for your time today and happy nursing.